Tired of the conflicting advice in the world of health and wellness? Ready for clear, science-backed strategies to live a longer, healthier life? Welcome to the Duration Wellness Show. We focus on health and wellness education to help you become a better, more informed you. Wherever you are on your journey, we're here with you for the duration.
So welcome to the Duration Wellness Show. Today's episode is going to be all about pregnancy hot topics. So today's guest is Dr. Megally, a board-certified OB-GYN, here to unpack some of the biggest questions in pregnancy. So excited to have you here. Thanks for joining.
Thank you. Thank you for having me. This is very exciting.
I don't know if you want to give like a little intro about yourself and background or...
Yeah, sure. So as you said, my name is Nada Megally. I am a board-certified OB-GYN in Atlanta, Georgia. I've been practicing for 6 years now. I was in private practice for about 5 years, and then I've recently transitioned to a hospitalist role. So it's kind of nice that I've gotten a little bit of mix of different populations. So yeah, it's been great, and I love my job, and I get to help women of all different ages and walks of life, and so it's been great.
Yeah. And on a side note, which is fun, Dr. Megally and I went to residency together.
We did go to residency together.
Yep. And so when I was pregnant, she got bombarded with all of my pregnancy questions.
Which I don't mind at all.
So basically that's what we're going to get into because I feel like it's very common.
It is.
So I think one thing that we can kind of start with, because there's almost information overload now, especially with social media. Mm-hmm. What are some common like pregnancy myths that you hear now?
So the first thing is yes, we are bombarded with information between TikTok and Instagram and ChatGPT and online. So I think that's like a very huge shift that we've seen over the past couple of years, where I think it makes it almost worse for some people. I know for me, when I try to look something up and now I'm like, there's way more information and you really don't know which sources to trust. So I think that's a very important thing to acknowledge, is that we do have information overload, and not everything is wrong and not everything is right, and two things could be correct. So it's very important to take everything that you see with a grain of salt and look at the background of where that information is coming from. And it can be correct for one person, but incorrect for another person, depending on your situation. So that's kind of just one thing I always tell my patients. But I think in terms of myths, I would say that the big thing that we get a lot is, people did this for years and people had natural births and, they didn't have medicine and everything was okay. And that is true to a certain extent, but I do think there's a role in medicine, and there's a role in decreasing the maternal morbidity and mortality that comes with pregnancy, which used to be very high, and we've done a really good job of decreasing it. So that's one big myth that we see a lot and we hear.
I feel like I've heard that all the time. And, again, yes. So women, we're made, to have babies and everything. And our body was created that way. But there was a very high, mortality rate, meaning people dying in delivery, right? That was very common.
And I don't think we have the statistics for it.
Yeah. And I think that people forget that aspect of it, that it's also, it's dangerous too. So
absolutely.
There's a lot of, positives in terms of modern medicine and helping with that. So
absolutely.
Yeah. So what are popular wellness trends that kind of concern you?
So we end up being able to pick up on what's trending on TikTok based on the questions that we get from patients.
That makes sense. Yep.
Yeah. So for a little while, it was a Rogam shot, and I can talk about that a little bit. But right now is vitamin K, and that's a big thing where we're seeing a huge movement where people are declining the vitamin K shot. And, I think it's very important. And I think I fully support patient autonomy. I fully want my patients to always ask the questions and know what they're putting into their body and what they're giving to their babies. But I think it's very important to understand why some of these things are given and the importance of them. And then at that point, you can make whatever informed decision you feel is best for your family. So yeah, one of the things right now is vitamin K. And what people don't realize, and maybe they do, and again, that's completely their decision at that point, is that babies are not born with vitamin K. Vitamin K is a fat-soluble vitamin that we get from food, we get from gut bacteria as we eat and as we grow. And what that is it is a byproduct or a protein that helps your clotting factors clot. So what that means is that it's what keeps you from bleeding out. And a lot of these clotting factors don't work if you don't have vitamin K. So if a baby is born, they don't have vitamin K, breast milk does not have very high levels of vitamin K, they can have a spontaneous brain bleed. And that can be absolutely catastrophic. And that is something that modern medicine has brought, which is great. It's a very small thing that has made a huge impact on overall well-being of these babies that were having spontaneous bleeds, especially premature babies that can have that very easily.
Yeah. No, I know. I've had a lot of friends ask me about that. And, that's when I go over, I think it's important, when people are making these decisions, to also know the dangers of not doing something like that, right? Which would be, bleeding, and it can be fatal, or it can be where the baby survives, but they have, mental disability that is, severely debilitating for the rest of their life. Right. And so,
absolutely.
People understanding that, and the risks of not having it, I think is also very important, because that comes up a bunch.
Absolutely. Yeah. And everything in medicine is risk and benefit, and just understanding why you're doing it. And then at the end of the day, it is your decision to decide if it's worth it for you.
Yeah. And I also like, what you talked about earlier in terms of, everything it's not black and white. And I think that especially on like TikTok and Instagram, that's like what I feel like I always see is like, you need to do this. You don't, but you can't do this. You have to do this. And it's like, well, this aspect could be true for this patient, but
correct.
This patient is in a completely different category, and this completely changes how they would respond to that. And so it's
absolutely,
medicine is individualized, right? We're all different, and we have like different risk factors. And so anyway, it's just something for, I think, when people are like listening to all of these TikToks and Instagram, to remember like, okay, well, they don't know all of my personal information.
Yeah.
So it's important to actually see your doctor and talk to them and everything. So, yeah.
Absolutely. I mean, we all get sucked into it. Even me, sometimes I'll watch something and then I'm like, wait, that has nothing to do with my situation, Yeah. So it is very important to remind everyone to just take everything online with a grain of salt.
Yeah. So I think something else that's important is diet in pregnancy. I feel like that's, talked about a lot. Yeah. So what would you say like a healthy, balanced diet should be in pregnancy?
So another myth, just to go back to your first question, is people think that pregnancy requires this just complete change from what you're doing at baseline. And for everyone, whether you're pregnant or not, the recommendations are essentially the same. There are some supplements that and vitamins that I'll talk about in a second. They're a little bit more critical, obviously, when you're trying to conceive or when you're getting pregnant. But the goal is always to have a well-balanced, nutrition-dense diet. In pregnancy in particular, you want to focus a little bit more on protein, because you're essentially making an entire human. And so you need those basic building blocks for building a placenta, building blood vessels, or building, your blood supply, or, making an entire human. So focusing on eating a protein-rich diet. You also need carbohydrates just as much as any other nutrient, because you need the energy. You need good, healthy carbohydrates to give you energy, not from processed foods. You need your leafy greens, you need your iron, you need your folate, you need all of that stuff. And you also need your fruits for your antioxidants and all of those things. So the goal is to just have a well-balanced diet. ACOG does recommend approximately 100 grams, 70 to 100 grams of protein per day. For a pregnant patient, or you can also do 1.1 kilograms per 1.1 kilograms per, what's the word I'm using?
1.1 kilograms per
1.1
protein
grams per kilogram of body weight.
Yeah.
Sorry, there
I
we
was
go.
yeah, but I got distracted because I was thinking, I don't think I ate that much protein when I was
Yeah, that is the it is
not good with that.
it is very difficult. Even, unless you're a bodybuilder, you're tracking your macros, it is very hard to get that much protein. So that's just one of the things that I talk about in the first visit with patients, whether it's a preconception visit or a positive pregnancy visit, especially for my vegetarian patients. Who really need to be very cognizant and very intentional with their protein intake because of their tissue healing, whether they end up having a vaginal delivery or whether they have a C-section. You really need all those proteins to help with your healing process as well as like the development of your fetus. So yeah, just having a well-balanced diet is very important. The other thing with nutrition is you really only need about 300 more calories per day, actually, per baby.
Yeah, which is wild because everybody's like, you're eating for two, and it's like, not
You're not.
quite.
Yeah, you're not. So if you have twins, you can say, it's 300 calories per baby per pregnancy. So you can say, 600 calories if you're having twins. And if you've got triplets, you can kind of just do the math and go from there. Yeah. But you really only need about 300 more calories per day to supplement. And of course, I tell everyone, again, whether you're pregnant or you're not pregnant, to try to get those sources of protein from natural foods. Of course, if you need to supplement, because it is obviously really hard to get that much protein, but a lot of the protein shakes and the protein bars have a lot of filler in them in terms of, processed foods, sugars, fats. So of course, if it's your only option, absolutely, but to try to really get those first, and then you can add on as needed.
Yeah, no, that makes sense. Mm-hmm. I mean, it's good for me to know because I think that I definitely struggled with that,
Yeah. And I tell people, you have to just look at the whole picture. If you are nauseous and you can't eat anything your whole first trimester and all you can eat is crackers, eat crackers. You don't need to be so worried that I need to get my protein, because babies are resilient. They will get what they need from you, but then you're a little bit more depleted. So it's better to be supplementing those things so you have the energy, your body is able to recover better. But again, if one day you're craving ice cream, absolutely eat ice cream, but everything's in moderation. So just prioritize the nutrients and then you go from there.
Yeah, no, that makes sense. What would you say the biggest nutrition mistake is that you see people making in pregnancy?
I think overall is the mentality of, I'm eating for two.
Yeah.
I'm going to just give in to my cravings. I'm going to eat whatever I want. I'll lose the weight after the pregnancy.
Yeah.
And people don't realize that significant weight gain in pregnancy can have negative impacts on your growing baby, on your recovery, on possible complications in your pregnancy. So it's really not just about, hey, don't eat, don't gain weight, but it does have an impact on the overall well-being of your pregnancy and your baby.
Yeah. Yeah, I can see that. So I do think that's still so common. Everybody, they're always like, even when I was pregnant, people would tell me, oh, you're eating for two. And it's like,
yeah.
Well,
I mean, you are, because you are growing a human, but, you're making everything from scratch. So you want to have good ingredients, essentially, if you think about it that way. If you want to make something that you're going to be lifelong, you want to use the best basic foundational ingredients. So you don't want to be eating sugary processed snacks. You want to be eating putting the best things in your body, because that's the building block of your baby.
Yeah, no, that makes sense. I feel like there's a whole list, in terms of pregnancy. It's like you find out you're pregnant and you're like, wait, I can't have all this stuff. Mm-hmm. So I think, how strict do people need to be about, I think deli meat is something that people always talk about. There's certain cheeses, sushi, mm-hmm. What is your usual recommendation for patients on those?
So again, back to with the vitamin K, I think, transparency and education is very important. So explaining why we say no to these things, not because we're just being mean or saying, you can't have sushi, but understanding why do we say no about deli meats? Why do we say no about sushi? So we do say to try to avoid them. So for deli meat, it's specifically listeria is the main thing that we worry about. And that can grow if it's, processed wrong, it lives on cold cuts, it can be packaged wrong. So if you feel like you have to eat deli meat, and sometimes that's all you can afford and that's all you have, and you just need to heat it up. So you just need to heat it up until it's steaming. I believe it's 165 degrees is where you need to get your deli meat, and then it's safe because that will be able to kill the listeria. In terms of sushi and unpasteurized dairy products, you can also have listeria, you can have bacterial growth, and so all of those things can be harmful to your growing fetus. So again, there's nothing that's black and white, it's just informed decision making. And even though the risks are really low, I believe the rates of listeria in the US is 1 in 25,000 pregnancies, so it's fairly low. But the consequences can be very detrimental. So it is, again, a decision that, do you have to eat this turkey sandwich? Do you have other options? If you don't have other options, or if you accidentally eat a turkey sandwich, I would not get scared or concerned. The risk is very low. But again, if it does occur, it can have some detrimental consequences. So making those choices for yourself is what's important.
Yeah. And also for sushi too, or do you need to have the raw sushi, right? Which is higher risk versus
you can get it cooked.
Sushi, you can get it cooked. You can get it, and I think sometimes people don't realize that, why it's not
why no sushi.
Yeah, why no sushi, right? And how you can still because I feel like sometimes you have these cravings and it's well, you could have an avocado sushi that doesn't have the raw fish in it. There's different ways that you can kind of still, feel like maybe you're having it and
yeah, I mean, if you just put soy sauce on something, it tastes like sushi. So. Yeah. But you're exactly right. You can go to a sushi restaurant and absolutely get a tempura roll or a cooked roll, or they have the baked rolls. So as long as they're cooked, you absolutely can have. But fish can be, especially that most fish is eaten raw or significantly undercooked. So it does increase that risk. And again, as we see in the news, there's been a listeria outbreak in spinach. There's been a listeria outbreak in eggs. So, you just have to do the best that you can. We know which items are the highest risk we tell people to avoid them. And even if you do eat something, it does not automatically mean something bad is going to happen, but it's something to notify your OBGYN about.
Yeah. Yeah. No, that makes sense. I feel like hydration is something that always would come up. People are like, no, drink your water, drink your water. Is that really as important as we say? If so, how much do people need to be drinking water in pregnancy?
Absolutely. So yeah, hydration is very important, and it's not just because we want you to drink a bunch of water, but it's actually very, yeah, because you're already going to the bathroom a lot, but hydration is actually very important for your developing baby. So you are expanding your blood volume. And so you have to think about that water that you're taking in is to supplement your circulation. It also supplements the amniotic fluid that goes around the baby. So if you are dehydrated, that fluid does decrease, and amniotic fluid is good for baby's lung development. If you don't have enough fluid around your baby, it can actually impact their development as well, which that's an extreme rare cases, but just overall. And then especially if you're somebody who is prone to UTIs, it's very important that you're hydrating to help decrease the risk of UTIs. Your cardiac output does go up, so you do need that hydration to help with that as well. So there's a significant benefit to staying hydrated, and the recommendation is about 60 to 80 ounces of water per day, which is a lot.
Yeah.
And it helps decrease Braxton Hicks contractions. So think of your uterus as a muscle. If you're dehydrated, you're going to get a leg cramp. So your uterus will start to cramp up as well. So all of those things are beneficial. And hydration is very important for that reason.
Yeah. I mean,
and especially if you exercise too, and it's hot and you live somewhere that's hot, that recommendation may actually be higher than that.
Yeah, no, that makes sense. I mean, I remember being pregnant, and obviously, you're tired, there's all that, but it's a lot on your body, right? And so I think being hydrated does help with that.
Yeah. I mean, it makes you go to the bathroom more, but it is important not just for our normal hydration. There's actually physiological importance to being hydrated in pregnancy.
Yeah. Now, what about the coffee? I love my cup of coffee. I think that's always hard for me in terms of caffeine intake. So I know
Yeah.
there's like tea drinkers too, but like, caffeine is also
Mhm.
something I remember being told that we have to limit. So what do you think in terms of how much caffeine can somebody actually have?
So ACOG, which is the American College of Obstetrics and Gynecology, does say that you can have about 200 milligrams of coffee per day, which is about I think that comes out to about like 12 ounces or so.
Yeah, I feel like I
Which
remember it was like 2 cups, maybe like
mhm,
3 small cups max. But it also depends on like, because it's
how strong.
milligrams of caffeine. Yeah, so it's how strong
Mhm.
is your coffee, right? It's like different if you're doing like a super strong espresso shot versus like,
Yeah, I think espresso is like, I think I've looked it up before. It's like 65 milligrams of caffeine.
yeah,
So yeah, it really just depends on, are you brewing your coffee at home? How strong are you making it? And again, if you need one day an extra cup of coffee, that is not going to be detrimental, but you have to just think about chronic caffeine use. Like, what does caffeine do that causes vasoconstriction? So if you have vasoconstriction, that's going to decrease the blood flow through your placenta, which will decrease the blood flow to your baby. So that's where, you can absolutely have a cup of coffee a day. If one day you need an extra one, that's okay. But, in extreme cases, we'll see, babies, detoxing from caffeine when someone's drinking an excessive amount of caffeine. So
yeah.
after birth, they're actually withdrawing from caffeine.
I didn't know
Or,
that. I always
mhm,
like I knew about the baby being smaller, right? Because and that being one of the risks because of the decreased blood
right.
flow, but I didn't know about like the baby withdrawing from caffeine.
I mean, that's like in
Yeah,
extreme cases.
yeah,
But, in those situations, I think people are also drinking. You have to be careful with caffeinated drinks, especially with Starbucks and Dunkin' Donuts. There's a ton of sugar as well. So you have to also be careful where your source of caffeine is. Because if you're drinking Cokes and sodas and, you know, those fun coffee drinks that you get at the store, they have tons of fats, tons of processed sugar. So not only are you getting caffeine, you're getting a lot of other things in there as well.
yeah. Well, and I feel like people don't realize sometimes they're like drinking those all throughout the day, right? And so
Hmm.
it's like, I mean, yeah, you're getting all the sugar and all the other stuff that's like also bad for you, but it could be way more caffeine than you realize. If you're having like
Exactly.
this tea out here and then this Coke here and then this, it all
And
adds up.
chocolate has caffeine in it.
Chocolate, yeah.
Yeah. And caffeine is not all bad in pregnancy. If someone is having a headache, we do recommend having a little bit of caffeine, a little bit of magnesium, a little bit of Tylenol, and those actually synergistically work together. So it's not everything is in moderation. And so again, just talk to your OBGYN, kind of figure out if you know that you're a very heavy caffeine drinker, a very heavy coffee drinker, you're going to conceive in the next couple months, that is a great time to start to cut back. So you're not fatigued from the pregnancy, plus you suddenly went from 4 cups of coffee a day to 1 cup of coffee a day. You're not going to feel very good.
Yeah. I know I missed coffee a lot. So what I did is I had like this blend that was like a third. It had a third of the caffeine amount of like what a regular cup would have. So then I could have
But you had a
more.
coffee aversion too.
Well, in the first trimester,
The
when I was
first one,
so
yeah.
sick. Yeah. And
But you
then
love
like
coffee.
yeah, around halfway, then I'm like feeling back to myself and then I'm like, I have to
Yeah.
have my coffee. But
I know.
yeah, the
Yeah.
first the first trimester I couldn't have it even if I wanted it. There was no
Yeah, you can even smell it. I feel like I remember that. Yeah.
yeah.
No, and most women nowadays work, so we can't just be like, oh, you are no, and you're exhausted in the first trimester. So yeah, just being cognizant of like everything that you're putting in your body and like how much your cup is, and just these, oh, I'm going to go to Starbucks here, do this, do that. It does tend to add up.
Yeah. I feel like cravings are something that everybody talks about in pregnancy in terms of like craving different foods. Are there
Yeah.
any like certain cravings you're like, wait a minute, maybe we need to do some labs, check out some things that's a little bit, concerning for something else, Is there anything like that or not really?
Yeah, actually, 2 days ago, we had someone come in who was eating 2 bars of Dove soap a day throughout her pregnancy.
Wow.
Which I have not heard of that one before, actually, but everyone hears of ice chips and
Yeah.
eating ice and cornstarch and dirt and some of these. It's called pica. Some people call it pica. I'm not really actually sure how to say it.
Yeah.
But yeah, so I think the important thing is food aversions. Typically, there's nothing overly concerning. That's just a normal part of pregnancy. So food aversions, I would not be concerned. Of course, food cravings. But when it gets problematic is when you're having cravings to non-food items. And that is actually the definition of PICO, is that you are craving eating things that are not meant to be eaten, even though ice technically is. But if you're having excessive ice eating, so that typically is a sign of anemia or an iron deficiency.
Yeah.
And typically in most OBGYN offices at your first visit, a panel is done to kind of determine where your baseline is. And then you should be getting another set of labs around midpoint at 28 weeks. But if you're coming in and you're noticing that you're craving these things, you should definitely let your OBGYN know so they can check your anemia or check your iron levels and see if they need to give you an iron infusion or possibly blood even.
Yeah. Yeah. No, I've heard, ice chips, I think is always what I think of, but soap, that's a first. I have not.
Yeah, that was my first for me. And 2 bars of soap a day throughout the past, the entire pregnancy. I think she hadn't told anybody, but it eventually came in.
Wow. That's rough. Cause I just think, man, soap I have tasted soap before, but that was cause I was a kid and I got in trouble and my mom washed my mouth.
No, she came in for abdominal pain and I was like, well, yeah. I'm sure your stomach hurts. I can't feel good, but we got her some iron and hopefully she's feeling better.
Yeah. Interesting. So I think, kind of getting into the next topic would be, more supplements and medications. Cause I think a lot of people know about prenatal vitamins. I think maybe touching a little bit on like prenatal vitamins, what's in them that's so important, and then are there any other supplements that you also would recommend?
Yeah. So again, prenatal vitamins are very important because unfortunately most people are not having a fully balanced diet in our day and age nowadays. And there are some supplements that you do need a little bit more of than you can have in your daily diet. So that's where prenatals come in to play and are very important. What people don't know is not all prenatal vitamins are created equal. And so depending on your medical history, potentially your prior pregnancies, or just overall what you're looking for, it is important to take a look at your prenatal vitamins and determine what's in them. So not all prenatal vitamins have iron. Some have more than others. So if you have sickle cell disease or sickle cell trait or beta thalassemia or alpha thalassemia, any condition where you are baseline anemic, it'd be important to kind of take a look at your prenatal vitamin or even take an additional iron supplement throughout your pregnancy. The other thing is folate, which most prenatal vitamins do have folate, but that's another thing that you would need to talk to your OBGYN about is certain conditions and certain things that could have possibly occurred in your prior pregnancy, such as a neural tube defect, if you've had a child with a neural tube defect or you're on any seizure medications. Those tend to have medications that are, they deplete your folate stores. So you do need to be taking higher doses of folate and you need to take them prior to conception. That's where it's most important. And then a big thing that people don't talk about is choline. Choline is actually not in a lot of prenatal vitamins. Actually, I don't know if it's in many or if in.
Yeah, unfortunately, it's typically not in them.
I think the ones I've seen just very minimal amount, if any, but you really
it'll be like 2% or 5%, and you're like, you put that in there just to list.
Yeah, and you need, I think it's like 450 milligrams is like your daily recommendation for it. So you do need, and that's for people who don't know, it's important for like fetal brain development. So, yeah, that's one thing I would say.
Yeah, and there was, I think like a new study too that came out, and it showed it was even higher than what ACOG has, which I think is 450.
Oh, really? Yeah, I think I have to go back and look, but it's something around there.
But it was like 900 milligrams.
Oh, really?
Yeah, that is what they gave. So they did a study and basically they looked at kind of like an IQ equivalent, right? And so the babies whose moms took the higher amount, closer to like 900 milligrams of choline, the baby scored a lot higher, like in terms of their IQ. Yeah. So it's
give me some choline.
I know, right? Like so anyway, I found that really interesting. And especially for people who are vegan, because I think like eggs, it's eggs in the egg yolks, but a lot of people, don't eat eggs as much, or they think they're being healthier eating egg whites. And it's like, no, actually the egg yolks.
Right. The yolks are actually very nutritionally dense. Like you actually want to eat them.
Yeah. So
you really can't find any with choline. And then, but those are really the main, and then DHA, but, it depends on really your diet.
Yeah.
So you can get DHA and omega-3s from fish, and everybody's a little bit different in terms of fish and their tolerance of fish. And, there's always a little controversy regarding fish and pregnancy, which we can talk about in a second. But, if you do get a lot of that from your diet, then you don't necessarily need to supplement. But for people who are vegetarian or vegan, I think those patients would be the most important to really get your supplements and take them prior to conception, because that's really the most critical time to have them.
Yeah. Yeah, I know. And then also, I feel like an aversion, I had in my first trimester, that was the other thing where it's it is helpful to take it ahead of time, because it was so hard for me to take anything in my first trimester.
Yeah.
So it's then at least you've gotten your stores up, obviously not everybody can, but that's ideally, I think they say you start all of these 3 months before.
3 months before. Yeah.
So
well, and the thing with prenatals and iron, so iron can make you really nauseous, like iron and zinc and all those things. So what I do tell people who are nauseous and can't tolerate them, you're not as likely to be anemic in the first trimester. That typically happens later on. Start with a gummy. I think most gummy prenatal vitamins don't have iron in them.
Yeah.
And so you don't necessarily need to be taking the iron as much in the first trimester. But if you're just getting something down.
Yeah, at least you're getting the folic acid down. And
exactly.
B vitamins,
So start with the gummies, and then later on, once you kind of feel a little bit better, you can transition over to an iron supplement or one that has iron in it.
Yeah. Well, I think that's helpful, because I know I get asked all the time in terms of when people are trying to pick out their prenatals, what do they need to look for? What's in them? So
absolutely.
Yeah. So folic acid.
And people don't realize it.
Yeah, no, they don't.
Yeah.
And that they're not all equal, and that they're
not
all the
absolutely.
same. Or they get kind of overloaded in terms of there's so many choices, they seem all the same, but they're not. How do I tell the difference? Yeah.
Well, and some can be very expensive. I think, the problem with social media is once you look one thing up, the algorithm just starts flooding you with, ads and things. And you're like, well, why is this one good? Why is it the influencer I follow uses this one, but maybe they're being paid to, market that one.
Right.
And so, talk to your OBGYN. I think I support people doing their research. I support people understanding why they're doing certain things and why they're putting things in their body. And so, there's nothing wrong if you're like, I eat 5 eggs a day. Okay, great. You don't need choline probably. Or, I eat a head of kale every day and spinach. Maybe I don't need that. So you can tailor everything to yourself.
Yeah. Which is important.
Yeah.
I think the other question is, what medications? I feel like there's always a list. You have to avoid a lot of medications. There's just so much. Because again, there's only so many things that are safe, when you're pregnant, for the baby's growth and everything. So how would you say someone should evaluate whether a medication is safe to take during pregnancy?
So the issue with pregnancy is that you just never know, and you can't run studies on people to see, hey, is this medication going to be safe or not? So typically most people err on the side of caution. But I would say that if you are someone with multiple conditions and you do take a lot of medications prior to pregnancy, I do think a preconception visit is very important, but these are the patients where it's very critical to go in and see your OBGYN, whether it's a year or 6 months before you're going to try to conceive, because most conditions there is an alternative medication that is potentially safe. And it may not be 100%, but you have to weigh that risk versus benefit in terms of, do you have a severe seizure disorder? If you come off of your medications, are you going to be seizing throughout your pregnancy? That's not ideal. Yeah. Do you have severe hypertension? Some blood pressure medications are not safe in pregnancy, but the risk of uncontrolled hypertension is way more dangerous in your pregnancy than taking a medication. So we can switch you to a different medication. Yeah. Same with diabetic medications, same with a list of conditions. So these are the patients where it's or especially anti-anxiety, antidepressant medication or bipolar medications. Yeah. These are all conditions that are very important that they're controlled in pregnancy because they can get worse. Right. And so we never want to just take someone completely off of them and say, hey, we don't know the safety profile, or, it's not 100% safe. These are very risk versus benefit to determine. So for those patients, a preconception visit is absolutely critical, and communication between your OBGYN and your neurologist or your primary care doctor or whoever, or your endocrinologist, whoever is managing these medications, to switch you and make sure that they're working well before you conceive.
Yeah.
So there's that. And then in terms of just basic over-the-counter medications, most OBGYN practices will provide you with a list of medications that are safe. I think most women choose to try not to take anything as much as possible, which is completely reasonable and understandable because, nothing is going to be 100% safe. Of course, nothing is better than something. But again, the risk of an uncontrolled condition or uncontrolled symptom can actually have a detrimental effect. So a very high fever, for instance, can have significant impact on a growing baby, especially in the first trimester. It can have neurological effects on the baby. Your neural tube cannot close. So, taking one Tylenol to decrease that fever is going to significantly be better than having a high fever versus, chronic use of medications, of course, can have a negative effect. So again, very important to talk to your OBGYN in terms of what is my symptom, what it is that's going on, risk versus benefit to what is going on, and determining what's best for you.
Yeah. So then I think, maybe next subject would be exercise, because that's something I know even for me, it was like there was a time period where I was like, am I exercising too much? Am I exercising not enough? It's like I feel like you hear both sides of the spectrum. So is it, I think, first off, safe to continue exercising in pregnancy? And then are there any limits if it is safe?
So that's honestly a great question because I do encourage everyone to exercise. However, there's a couple caveats in there. Exercise has a lot of great physiological benefits, and I'll go over that. But I think it also depends on someone's medical history and their mental status. So if I have a patient who has unfortunately had multiple miscarriages, even though the evidence does not support that exercise does cause miscarriages or is going to make your body do anything, that mental aspect of it, if something did happen, if you're exercising, could have a significant toll on someone. So you kind of have that conversation. You say, hey, there's no evidence, but I understand that this may impact you if something did happen. And you have them scale back. You have them, just do some walking, just do walking around the neighborhood, just walk around your house just to kind of still get that benefit. So there's that subset of patients. And then there's the patients who are very active and are like, I have to go to the gym every day and I'm a marathon runner. And you absolutely can continue to do all the exercises that you want, but listen to your body. There are certain things that you should not do when you're pregnant. So contact sports, horseback riding, scuba diving, anything where you might fall, rugby, football, all those things, definitely avoid. But you can absolutely continue running. If you were a runner before, you can continue to CrossFit. If you were CrossFitting before, you can do yoga. We do recommend against hot yoga and like saunas and things of extreme temperatures, especially in the first trimester. And then if someone has never exercised before and wants to, then yeah, absolutely. Swimming is a great exercise to do because it's really great on your joints. Walking is great to just start off with. Small walks a day, kind of increase as you go, listening to your body. Because the more you're active in your pregnancy, the better your recovery is going to be. It's also going to help with your glycemic control throughout your pregnancy.
Yeah, no, I mean, it's so helpful, I feel like, in every aspect. And also something, it's like, I remember this was a little bit silly. I don't recommend this, but I worked out the morning I went in I ended up having to be induced. And I was like, I'm going to get my workout in. That was very silly because
it's not though.
But delivering is like such a workout that
It
I was
is,
like,
yeah.
the day before, yeah, but like that day, I mean, I needed all that energy. I was like,
Yeah. I
but
do always wonder how many calories it burns. I'm always like, did you have your Apple Watch on? Like, how many
yeah.
calories does pushing a baby out burn?
Yeah, because it is, I mean, it is intense. But all that
Yeah.
to say, I mean, that's where I think exercising is so important throughout your pregnancy
Hmm.
because the delivery process is like it helps if you're in better shape,
Absolutely.
right? So not only does it help decrease all these other risks too that I'm
Absolutely.
sure you'll talk about, but like, yeah.
Yeah. And I do actually notice a difference with my laboring patients who have exercised throughout their pregnancy and have been active.
Yeah.
They tend to have a smoother labor curve and they tend to also recover more quickly. So
Yeah.
there are a lot of benefits from that aspect as well.
Yeah. Do you find that any exercise is better than another type? Like, is there any specific exercise that you recommend or just, what somebody enjoys is what they should do?
I think what somebody enjoys is what they should do because for me, I hate yoga. I hate Pilates. You know this very well.
Yeah.
And so if somebody told me all I can do is yoga and Pilates, I probably will not be exercising because I hate it. I enjoy different things and someone might hate HIIT workouts and they may hate running. So you really, whatever you were doing before, you can absolutely continue to do, obviously tailor and also just I didn't mention, there are certain things in pregnancy that you are not supposed to exercise. So it is very important to just check with your doctor before you continue on if you do get diagnosed with anything in the pregnancy to see if it is okay to exercise.
Yeah. What are like big things that would kind of make you tell a patient where, hey, you can't exercise?
So the biggest ones are going to be, threatened preterm labor.
Okay.
So if somebody has a short cervix, someone is dilated early on in their pregnancy with, their membranes bulging, that's of course fairly obvious. But if someone is, typically these patients are in the hospital, but some patients will be, if they're pre-viable, will go home. But if your water is broken and you're at home, absolutely. If someone has an abnormal placenta, something called a placenta previa or a vasa previa, where the blood vessels are close to the cervix or the placenta is covering the cervix. These are things that you don't want to cause any kind of like friction or irritation to the placenta because you could have significant bleeding. So those are.
When would you see that? Because that probably wouldn't be in your first ultrasound, or would you see it already in the first ultrasound when you're checking for like the heartbeat?
Yeah, so typically you wouldn't see it in the first trimester. Most of the time, in terms of the placenta, yeah, typically most placentas are pretty low in the first trimester with that like first the first ultrasound. So nothing to worry about. But once you get to your anatomy ultrasound, which is typically about 20 weeks, at that point, your placenta should have moved. So if it is covering the cervix or if it's within 2 centimeters of the cervical os, it's considered a low-lying placenta. Or there's something called a vasa previa, which the blood vessels of the baby are exposed and they're not covered. So those are fairly high-risk pregnancies. And in those situations, we do pelvic rest, so no intercourse. In those situations, you can walk around, you can do walking, but depending on the severity of it, we may put some people on bed rest, or if you bleed, you actually get admitted to the hospital for the remainder of your pregnancy.
Wow. Interesting.
Mm-hmm. Huh. Yeah. Some will resolve and some don't. So those patients will get frequent scans throughout the pregnancy to see.
That makes sense. In terms of like or I guess somebody has like a relatively healthy pregnancy, they don't have one of those contraindications and they're working out, what is your kind of, where do you tell people like, should they be monitoring their heart rate or checking anything when they're working out and like not be going past like a certain exertional level?
I don't know if there's particular guidelines regarding that. I would say that the most important thing is listening to your body. Everyone's baseline heart rate is a little bit different. Like if someone was a marathon runner, their heart rate is going to hang out a little bit lower than someone who's really hasn't been walking frequently. But I would say your recovery is very important. So if you get done exercising, or if you get done walking and it's taking a really long time for your heart rate to come down, you're feeling excessively fatigued afterwards. You're really struggling through a workout that you were doing before, then that's something that you should be concerned about and just, talk to your OBGYN, maybe scale back a little bit. and see how you feel. And if you're still not, maybe scale back a little bit more. And so just listening to your body and just kind of determining how fast does my heart rate recover? Do I go back to, I just did a workout. Yeah, it took me 30 minutes, maybe a little bit longer but I feel normal the rest of the day, then I would say that's okay. But if you did a workout and you really just can't recover, I would say that's probably not normal.
No, that makes sense. And we kind of talked about it a little bit, but what would you say are the biggest benefits, for being active during pregnancy?
For me, I think mental health is a huge benefit to exercising during pregnancy, getting outside, seeing the sun, getting your body moving. Like we talked about, stamina in labor is a huge thing. The more active you are, the better your recovery is, the better you're going to do during the labor process, because it is a huge impact on your body, pregnancy and delivery.
Yeah.
One of the biggest benefits is preventing excessive weight gain in pregnancy, because with excess weight gain, you can develop gestational diabetes, you can develop hypertension. So it does help with glycemic control. It does help with weight gain. And with all those things come complications. And then the other thing is pregnancy is a hypercoagulable state. So, we are physiologically built to clot more in pregnancy to prevent bleeding.
Right.
And even though that's amazing, but the more sedentary you are, the higher the risk you're going to have of developing a blood clot. And so getting out and moving, even our patients that are admitted to the hospital that are on bed rest, we're like, get up and do a lap in the, in the room, get up and do a lap in the hallway. Or if they absolutely can't, we do have to put what we call SCDs on their legs to help with their circulation. So these are all benefits.
Yeah, no, that makes sense. I know, especially for glucose control, that's it helps so much, because the more muscle you have, right, that's going to help pull in that sugar and everything and help regulate, insulin and everything. So very important. And then that helps, if you're
diabetic already. Yeah.
Yeah. So
if you develop it, you get it, you've had it, it's very helpful.
Yeah. So sleep, I think, is something else that is always an issue in pregnancy. Everybody's like, well, first there's the whole first trimester exhaustion, which is unreal. And then you get into okay, now I can't sleep.
I can't sleep. Absolutely.
So I think, maybe starting with, why is the pregnancy fatigue so intense?
So there's a lot of factors actually, but the main thing is progesterone. So progesterone is, and every woman who's had a cycle and has had a progesterone surge understands that fatigue, like when you get your cycle and you're like, oh my God. So imagine that times 1,000 is essentially what's happening. So your progesterone levels skyrocket at the beginning of the pregnancy. And progesterone actually has what we call a sleeping, calming effect on your body. So it's not that you're being dramatic, it's not that you're anything, but it truly does make you feel very tired and very sleepy.
Yeah.
So that's one thing. The second thing is you're creating a human. You're building a placenta, and so your body is physically making an organ from scratch. So your heart rate goes up, your cardiac output goes up, your body is increasing its blood volume. And so you are just on the go, and your cellular growth and your cellular turnover is double, triple what it is at baseline.
Yeah.
And on top of that is you may be nauseous. So you may not be eating. So you kind of are in almost a calorie deficit. So you're not getting the nutrients that you need. You can get insomnia from hormonal changes. You are getting up to go to the bathroom a little bit more.
Yeah.
So all of these things together in the first trimester can make you and if you were someone who's drinking a lot of coffee and suddenly stop drinking. So
yeah, that's true.
Yeah. So you have all these factors in the first trimester that make you very, very exhausted. You feel great in the second trimester, and that's when they say, that's because you're out of your nauseous state. You're not pregnant enough where you can't sleep, so it's the sweet spot.
Yeah.
And then you get to your third trimester, and then you go back to now you're uncomfortable. You can't get in a comfortable sleep position. there's the recommendations of how to sleep, and people kind of subconsciously are worried.
Yeah. So I feel like that has gone in like you can only sleep in these certain positions to like, no, it's fine, to then back to no, actually you have to, once you hit third trimester, only sleep in certain positions. So like what is the reasoning behind that? What is the sleep position that is recommended? Does it matter?
So it does matter, but it's nothing to freak out about either if you end up waking up on your back or on your right side. So the reasoning behind it is that you have your inferior vena cava, which is the big blood vessel that takes all the blood from your body and shunts it back to your heart, and then that gets pumped back out to the placenta. So when your uterus gets bigger, if you lay on your right side, it can obstruct your inferior vena cava and decrease that returned blood flow to your heart that gets pumped to the placenta. And so that is the theoretical reason of why you should not be sleeping on your right side. So most people will tell them to put a wedge or a pillow just to kind of elevate their body off of their right side. With that being said, it is not detrimental if you end up waking up and you happen to be on your right side, or if you laid completely flat on your back. It is a recommendation that you should try to follow, but it's not something that you should absolutely stay up at night because you can't get comfortable or worried that you might roll over.
Yeah.
So there's wedges that you can buy so you can't accidentally roll over. Some people just use a pillow, fold it, or roll up a towel, and you just need to elevate yourself a little bit off your right side.
Yeah. What about, I feel like I've heard of some people where they can't lay down at all. And I think because they'll get like, more like sleep apnea sort of symptoms. And they end up having to like fall asleep in like a chair. Yeah.
Yeah. So that is, so if you think about your diaphragm is right here, right above where your uterus is.
Yeah.
And as your uterus gets bigger, when you take a deep breath in, your diaphragm expands, your lungs expand. So you really don't have much room anymore to expand. So when you lay down, that can kind of also move up. And so it makes it very hard to breathe. So we do see that more kind of towards the end of the third trimester, where people are just like, I have to sleep sitting up. Yeah. And that's because of that is, you lay down, the uterus comes up, and that decreases that volume of your lungs even more.
Yeah. Is it okay in terms of like positioning to like sleep sitting up? Okay.
Yeah, honestly, any position that you can sleep in is a good position towards the end, is that you really need to be getting as much sleep as you can. The main big thing is not to sleep completely on your right side, everything else, and obviously not directly on your stomach. Not that I think anybody is doing that, but I don't think you physically can. Yeah, I don't think you can, even if you wanted to, but the main one is the right side. But I see so many women, they're just like, only way I can get comfortable is sitting up in a chair at night, and they start sleeping in a rocking chair or one of those lazy boys. And if you're sleeping, that's what's important.
Yeah. Yeah, that makes sense. Mm-hmm. Is there any time where you would like be worried that like the fatigue is like more than pregnancy fatigue, like where it's more than, you're just pregnant?
Yeah, absolutely. I think the main thing I tell my patients is fatigue and symptoms that are normal are typically linear. So, first trimester, okay, that makes sense. You're tired, or, if you have leg swelling and it goes away and it's kind of progressively getting worse and you're like, okay, but something that's more acute or severe or overnight is going to be more concerning. So, shortness of breath with walking, but then you sit down and you recover. Okay, that's okay. But if you were just short of breath sitting, not even able to talk, that's not so normal. Or if you have been exercising every day and suddenly you woke up and I can't even walk up a flight of stairs when yesterday I ran 3 miles, that's not normal. So anything that you would say is acute and sudden and severe, it's definitely something that you want to tell your OBGYN. Yeah. Or even go to the ER if it's sudden enough, like sudden chest pain, sudden shortness of breath, when 10 minutes ago you were fine, concerning. But I know it's weird, but if it makes sense, like, hey, I'm in my third trimester and I'm having a really hard time going up the stairs and I'm winded, but when I lay down, I kind of go back to normal. Um, those things, definitely still mention them to your OBGYN, but those are typically just normal physiological changes in
That makes sense.
And the great thing with Aura rings and Apple Watches now is most people can kind of see where their heart rate hangs out.
Yeah.
So if you're just sitting around and your heart rate's just 130, that's typically not normal.
Yeah.
Of course, everyone. But so we do have a lot more data now, which is great to be like, hey, I'm at 140.
The wearables, I think, do help with that a lot. Like, I mean, we even have people come into the hospital, not in terms of like pregnancy, but just other issues, and they'll, come in because their watch or, whatever wearable device they had kind of was telling them to. And
it's great.
Very helpful.
Yeah.
We talked a little bit about, anxiety and, exercise helping that. I think postpartum gets a lot of focus in terms of postpartum depression, but I feel like it's not talked about all that much, anxiety and depression that kind of occurs in pregnancy. So how common are those? Do you see that?
Oh my gosh, so common, so common. I do think we're seeing it more and more. I don't know if societal stressors are significantly higher than they used to, which I do think they are. And I think that makes a huge impact. But, most OBGYN practices, and I would say all, should be screening patients for anxiety and depression when they first come in for their first OB appointment. There is a screening questionnaire that they should be given. And then depending on how they score, that will tailor the rest of their screening. So if someone, it's, I think 10, or I can't remember, 10 is positive or negative. If you have less than a 10 score, then, you're not at high risk, but you should still be screened in the third trimester and postpartum. Yeah. If someone scores very high and, there's certain questions that are considered, I don't want to say red flag, but to make you more aware that you should be having that patient come in more frequently. So you always need to look at those specific questions and how they answered them. So those patients in particular, will have them come in a lot more frequently, provide them with resources early on, even offer medications, and talk about risks and benefits of those medications. Because again, this is one of these situations where you may not want to take a medication, but the risk associated with severe depression or severe anxiety in pregnancy, outweighs that risk associated with that medication.
Yeah.
And so, go ahead.
Well, I'm just curious, like, when would you say is kind of what are things that like a patient should be looking out for in themselves? Because I think some anxiety, and a little bit of mood changes is probably normal, but like, where should they kind of be thinking, hey, I should probably, if they haven't done the screening or if it wasn't, maybe missed or whatever, like when should they be asking like, hey, I think I need a little extra support,
Yeah. So I would say like loss of interest in things that you were previously interested in, especially if you have a family and a partner and other children. If you're noticing that you're kind of dissociating and not as engaged with your family, kind of pulling back, sleeping more, or sleeping less significantly. Those are also things that you need to be looking out for. Excessive crying, or lack of appetite, or, just other family members making comments and noticing that, hey, you're not yourself anymore. So those are things that for a patient to be aware of and say, hey, this is, but it is very hard for people to notice these things.
Yeah.
Because a lot of times they creep up and they're very slow. And a lot of people make excuses of, oh, I'm just tired. Oh, I'm just overwhelmed. So even though it is very important for patients to be cognizant, I think the role of the family is very important to recognize these things, but also your provider.
Yeah.
There's certain things that we notice, certain wording, certain verbiage, certain, affect when patients come in, that your provider should also be picking up on, especially if they've been a long-term patient. It's easier to pick up, but it can be very difficult.
Yeah, especially if it's like, the first time you're meeting him is when you're coming in and you're pregnant. And then, it's hard to
Yeah.
know, is that like they're normal or is that new?
Yeah.
Although
And
it
there's
is,
like society, things can happen in life. Some people might be going through a divorce. Sometimes their partner, something happened, a family member, so there's
yeah,
a
like a
lot of,
different sort of stressor that's there that's not necessarily from, yeah.
yeah.
It's hard. I mean, I remember I think the whole you don't have as much control in pregnancy is hard. So that for me was a
Oh,
little
I
bit
can't
more,
imagine.
yeah, anxiety
Yeah.
provoking than I realized. And I feel like I'm, baseline not an anxious
Yeah.
person, which is, I think, a blessing. But like for pregnancy, for me, I was like way, especially with my first pregnancy, way
Oh,
more
for sure.
anxious than I expected. So it was kind of a surprise to me,
Mm-hmm.
So,
Well, yeah, and for people who are baseline anxious, that can really start to interfere with their life. So, we do have a lot of patients who, again, we always encourage people to call if they have questions, but there are some people where you notice a trend of, okay, your anxiety is actually interfering with you going to work, with
Yeah.
socializing with your friends and family. You really can't function
right.
anymore. And those patients, we definitely will have them come in, and you never want to be accusatory, but you kind of start having these conversations with them of like, how are you feeling? What's going on?
Yeah.
Because it can get worse before it gets better.
Yeah. Then you want to like start giving support early. No, it makes sense. What, we talked a little bit about exercise, which I think would play a role in this for sure, but like what are some simple habits that can kind of help people, support their mental well-being?
It's tough because I don't think we have great mental health support
Yeah.
for women, and especially pregnant women. It's very difficult. I think recognition is the first thing, especially if someone, we do see women who are on anti-anxiety, anti-depression medication. So again, I keep talking about it, but that preconception visit is very important. So coming in and recognizing, hey, I have bipolar disorder, or I really struggle, or I had really bad postpartum depression in my prior pregnancy that really affected me, or any of those things. So being honest with yourself and not being embarrassed, because it's not anything embarrassing. We just want to get you the proper help or get you on the right track so you don't have to worry about these things again, is coming in for that preconception visit and saying, hey, I probably need to get on something prior, or this is what I've been on, because a lot of these medications do need to be adjusted in pregnancy because your metabolism changes. So some of them need to go up in the dosing. So that's also very important. Having a good support system, but of course, not everybody is able to have that, unfortunately. But there's support groups online, which is the good thing about social media. Good and bad thing about social media is there's a lot of support groups out there that you don't even have to leave your house. There's therapy sessions or counseling sessions that you can go to via telehealth. So I think the biggest thing is not being embarrassed about it, because it's not anything to be embarrassed about. It's a disease, it's a condition, just like everything else, just like hypertension. It should be treated exactly the same.
Yeah.
And so just being honest and telling your provider and speaking to those around you and letting them know what's going on is going to be the best thing you can do.
Yeah. Yeah. Asking for help, and I think definitely getting, support where you can. Yeah. So important. And then, of course, the eating healthy, the trying to sleep, which is again difficult in pregnancy, as we just talked about.
So difficult.
But the eating healthy, the sleeping, and the exercise, all of that helps support too, which is,
Yeah.
but it can be hard because sometimes you can feel like paralyzed in this, for some people, in terms of how bad their anxiety and depression can go.
No, and I can't imagine.
Go and get help and talk to your provider and try to, so I think one of the other questions that comes up commonly is weight gain, which we talked about a little bit in like body changes. So, what would you say is like the average amount of weight gain that's recommended, right? Because you don't want to gain too little, but then again, we also talked, you don't want to gain too much. So,
so there's actually not one number that is given out to everyone. It actually has to do with your pre-pregnancy weight in terms of how much you should be gaining. So if you're starting out at an underweight level. So say your BMI, I believe is like 18.9 is considered underweight. I think the recommendation is up to 40 pounds of weight gain.
Wow. Okay.
And then
that's even more than I would have expected.
So it really has a lot to do with where you start. But then if you start off considered obese, which your recommendation is only about 11 pounds of weight gain.
Okay, so much less.
Yeah.
Basically, your body's like, I already have the stores. You don't have to like build it up.
Yeah. So I don't like to talk about pregnancy weight as like weight. It's like nutritional needs, because that's really what weight is. And as women, that can be a very sensitive subject. And in pregnancy, body image is huge. And some women who struggle with that before can have a really hard time with seeing the number, talking about the number, feeling a certain way about their body image. So those things are very important, because you don't want to have excessive weight gain and you don't want to have very minimal weight gain either. But reframing it as, it's a nutritional need. So if someone is, because the baby will get what they need. And so if someone, is overweight, they don't have to provide as many nutritional needs from the outside as someone who may come in the pregnancy underweight and already, requiring a little bit more nutrition. So there are guidelines in terms of exactly per your BMI, per your weight, how much you should be gaining. But it really depends on your pre-pregnancy BMI.
Okay. And then what would you say are like usual body changes, that happen in terms of like with this weight gain and everything in pregnancy versus like somebody should be concerned and get it checked out?
Excessive weight gain is a big one. And I think that kind of unfortunately plays into one of the first questions is like, what is normal? How much should I be eating? And a lot of women are like, oh, and I feel like I will also potentially be that, is like, oh, I can't wait to eat whatever I want. But with that excess weight, eating for two. And that can make it very difficult to mobilize because you're already having a difficulty mobilizing with just a pregnancy. So if you have that excess weight gain, it can be really difficult on your joints. To remember, progesterone does make your joints and ligaments more lax. So it also makes it more difficult to get up and do things, and it's very painful. So those are some major pregnancy changes. And even if it is a healthy amount of weight, for someone whose BMI is 18 starting out to gain 40 pounds, that's a significant difference for them. So that's a big thing. Water retention. Progesterone and your hormones can make you retain a lot more water. So you may not be gaining fat specifically, but you are gaining still weight just by retaining a lot more water. So that can also be very difficult. So your fingers will get more swollen, your legs will get more swollen. Your face may be a little bit more swollen. Those are all normal, but these could also be signs of preeclampsia. These can be signs of things that are abnormal. So it is important to monitor those things and determine, hey, does my swelling kind of go down at the end of the night? Do my feet get better when I elevate them? Is it linear? I'm like slowly getting a little bit more swollen, or did I just wake up 10 pounds heavier today with water? That's not normal. So that's, something to look out for. Those are some of the changes. Your center of gravity changes a lot. So someone who does yoga or Pilates or is into skating, which I would not recommend in pregnancy, your center of gravity does change and you do have more back pain and things like that, which again are normal, but they will definitely affect you during the pregnancy.
Yeah. What do you tell patients who are like worried about like bouncing back? Like, I want to bounce back.
That's a hard one. Again, I try to shift the mentality as much as I can, because as a woman myself, I can't lie that would be something I'm worried about too. But, I try to shift it into, let's focus on how amazing your body's doing right now. Like what your body is building a human, you're building, a miracle of life, and wow, how amazing can your body, like that your body can sustain this. And once the baby comes, it's a recovery journey. It is, you will get there, but, every part of it is beautiful in its own way. And you don't want to minimize their concerns and you don't want to minimize their fears. And because it's very real to some people and can be very debilitating to them. So you want to recognize that, like, yeah, there will be some changes, and you will get back there. You may not, and just setting realistic expectations in terms of, shifting their focus to try to focus on the positive.
Yeah.
But it's hard. That's a hard one.
It is a hard one. No, I
Yeah.
mean, I think that's just as females, I think that can be something that we, can struggle with easily. I think it can be a common thing, but I do love and I also love that that's actually becoming a trend. One of the trends that I do like is that people are focusing less on the bouncing back and more on the, wow, this is amazing that I was able to grow a human and, that now there's this new life and, that my body was able to go through all of those changes and it was, it can be difficult, but also such a beautiful process. So I think celebrating that is so important, and kind of having that mind shift is a good way to look at it.
Yeah.
When do you recommend for people to see a pelvic floor physical therapist? Because I saw,
Always.
I saw them both times for my pregnancies, but I found it was very helpful. But I think a lot of people don't realize that's an option. And actually,
I don't think it's talked about enough.
Yeah.
Yeah. I think to me, it's like exercise. It is, your pelvic floor are muscles. Your rectus abdominal wall are muscles. So I don't think there's ever a bad time to go. If you want to start going before you get pregnant, great. If you want to go throughout your pregnancy, amazing. It is probably the most helpful to go after a pregnancy, or specifically, if you unfortunately had a traumatic birth, or, some of those risk factors that increase your risk of, pelvic floor prolapse occur. But it definitely, think about it like exercise. If you've already trained your muscles to kind of do something, it's going to be a lot easier for you to kind of get there postpartum versus, hey, I've never worked these muscles before. They're already so weak. It's a lot harder to get you there. Yeah. So I don't think there's ever a bad time unless you have a contraindication, which again, that's something to talk to your doctor about.
Yeah.
But overall, I think it's good for everyone anytime to go.
Yeah, I know. I went, both during my pregnancy and after, and I found it so helpful, even in terms of some of the things that we would go over is how to relax and, the different muscles and everything. It's just something that even as a doctor, I wasn't aware of, it's not something that I get training on,
Well, and it's hard because it's not cheap.
Yeah.
I think that's considered more of an elective, which I don't think it should be. But it's something that you kind of, insurance is not going to cover it. You have to go out and seek it on your own. And you can look some stuff up online, but people don't realize that pelvic floor physical therapy is not just Kegel exercises. It's a whole.
There's so much more. But I do think there's more now online, and not obviously everybody has this, but there are places where sometimes they have these virtual physical therapists, where they're cheaper and they can at least go through some of the basics, and some jobs they'll have that included, which is also a resource I think that people sometimes forget to look into.
Yeah, absolutely.
How often in terms of appointments, because I feel like people are on the spectrum, either they see their OB-GYN way too much and they're I can't believe I'm going to all these appointments, or they're I never see them and all of a sudden I'm having a baby. So how often?
Which is not a bad thing. I tell people, if you don't see me, because I work with midwives and I joke, I'm if you don't see me, you're having a great pregnancy. Yeah. Not that others are bad, but it means you're having a low risk pregnancy, because we're not going to let you just fly under the radar because we don't feel like seeing you. It just means that you're good.
Yeah. Yeah. How often should they expect to see you?
So I will tell you, for a healthy, uncomplicated pregnancy, I can only speak on the private practice that I worked in. I'll tell you the actual guidelines, but we would have, a positive pregnancy visit just to confirm that you are pregnant, because sometimes you come in and you're not pregnant, or, whatever happens. So, and then we kind of determine how many weeks you are based on your cycle at that visit. We do see a lot of people get upset. Oh, I'm not getting an ultrasound today, but you're really not going to see anything if you're anything less than about 6 weeks or so. And so we'll have them come back. You don't always see a heartbeat that early either. So we'll have them come back at typically 8 weeks, and you should definitely be seeing something at that point.
Yeah.
Again, that can really change if you come into your positive pregnancy visit and you're bleeding. That changes the whole, trajectory of how often we're seeing you, what we're doing. Are we getting blood work? Are we doing an ultrasound the same day?
Yeah.
What happened in your prior pregnancy? So that's very different. But if everything's okay, hi, I'm pregnant. Great. Come back at 8 weeks. You'll get an ultrasound. You confirm the pregnancy. And then typically you would come back at about 10 weeks for your first OB visit. At that visit, you'll get blood work, which is like your basic prenatal labs to check your iron levels, your immunization status, hepatitis, rubella. You'll check your thyroid level, which can change a little bit at the beginning of the pregnancy and determine if you need to take medication or not. You'll get a pap smear if you haven't had one. They should be looking at your cervix at that first visit to make sure there's no concern or anything that would cause them to need to check on it more frequently. And then if you are a candidate, they'll offer you genetic testing at that visit. So that's the NIPT screen that checks for Down syndrome, trisomy 18 and 13. After that, you really come back once a month for a while. So up until 28 weeks, you just go in every 4 weeks. And then once you hit 28 weeks, which is your third trimester, you're going to be coming in anywhere between once every 2 to 3 weeks until about 36 weeks. And then after 36 weeks, you'll come in once a week until delivery. But if there's any complication or you have any new diagnosis, if your provider is concerned about anything, whether it's anxiety and I need to see you more frequently and I just want to check on you, whether it's anemia, whether it's hypertension, whether your baby's not growing appropriately, whether we saw something on the ultrasound we didn't like, so I would say very few people have that just perfect, which is great. And I think it makes people more anxious than not to say, you're good, don't come back till later. But it is a great thing to not need to come back. But I would say as more and more women are having babies later, and at older age, those patients do need to get screened a little bit more frequently. So I would say for the most part, most people come in a lot more frequent than that.
Yeah. I know for me, for my first pregnancy, I had to go in way more frequent because the anatomy ultrasound picked up something that was like a little bit abnormal. So I was there. It felt like all the time.
Yeah.
But for my second, I didn't have that. And so I remember being like, wait, this is all this is what's going on. Like,
it feels weird.
Like a little weird. Yeah. I was like,
and people get stressed. They're like, can I see? And it's like, well, ultrasound is safe, but you also don't want to keep just doing an ultrasound.
Right,
we don't,
have to. Yeah.
Exactly. So I think it causes some anxiety, but I try to reassure that means nothing is wrong, which is great.
It's a good sign. Yeah, it's a good thing.
Yeah.
So what screening tests are like the most important, and, we kind of talked about ultrasounds, how often they're done and when they're done. But I think also for people who haven't been pregnant, I think one thing that can be surprising is that it's not always an abdominal ultrasound. I think that's what's shown on TV. That's what's shown in the movies, right?
Yes.
But that's a lot of times you're actually doing a transvaginal ultrasound. So I think maybe also going through when you kind of switch over, and the types of ultrasounds that you're doing. And
why. So early on in the pregnancy, so a couple of things that make a difference is body habitus. So if you are your BMI is higher, it makes it a little bit more difficult to see your uterus because the uterus is really not as big as people think at the beginning.
Yeah.
I would say probably about this big, and it's very low in the pelvis. So for someone who has a bigger body habitus, sometimes earlier on in the pregnancy, you would need to do a transvaginal ultrasound because it gives you a more direct image directly to the uterus, and you can see really well. I would say that most people in their first ultrasound versus visit will get a transvaginal ultrasound because we want to see really clearly.
Yeah.
Very few people, I would say, you can see abdominally like a yolk sac or, a crown rump or a baby that's barely has a heartbeat. So I would usually expect a transvaginal ultrasound in your first visit. The second ultrasound that most people get will be a nuchal translucency ultrasound, which can be anywhere between 11 to 13 weeks. Most people can get that abdominally. Again, if your body habitus is a little bit bigger, that can make it more difficult to see. So that's when you would do a transvaginal ultrasound. And then by the anatomy ultrasound, most people, I would say about 100% of patients, you can see everything abdominally. So you should not need to do a transvaginal ultrasound. However, if someone has risk factors for preterm labor or short cervix or an incompetent cervix, or has had a history of a LEEP procedure, those are all risk factors for a short cervix. And so the only way to be able to accurately see that, especially early on, is doing a transvaginal ultrasound where they can measure the length of your cervix. And so,
I didn't know that. Okay.
And so if you, for instance, has a history of a LEEP procedure, you will be getting every 2 weeks your cervix measured, because that can increase the risk of a preterm delivery or short cervix. Or if you've had a preterm delivery and a prior pregnancy, they will also be looking at your cervix every 2 weeks until you get to about 24 to 28 weeks to make sure that your cervix is not shortening. So those you typically will get a transvaginal ultrasound, or if they're also looking at your placenta, especially if it's a placenta previa or a vasa previa, which is what we talked about earlier, you'll also get a transvaginal ultrasound.
Okay. That makes sense. Screening tests. What would you say are like the really important screening tests for people to get?
Again, preconception is the best way to determine a lot of things. So if you know that you are a carrier of a specific gene, a bunch of people in your family have it, or for some reason you know that you're a carrier, it's very important, depending on what that is, to get your partner tested, because some diseases can be detrimental. Some diseases are recessive in nature, some are dominant in nature. So that's one thing, is to go through genetic screening if most people don't know, and I would not recommend routine genetic screening for anybody. But that would be one thing. In terms of blood work, most people don't need any excessive screening. You just get your regular routine blood work. Your thyroid is very important, because if it's too high or too low, that can have negative consequences in the pregnancy, increased risk of miscarriage or stillbirth. So that's important to get checked out. Anemia screening, that's very important. One of the things I didn't mention in terms of body changes that are not normal is if you're bruising a lot. Some people can get thrombocytopenia in pregnancy, which is low platelets. And so if you're noticing that you're having a lot of bruising or a lot of things like that, that's also very important too. Then that's part of your routine screening, so you don't need to be asking specifically. And then risk factors for genetic abnormalities, which is your NIPT, which is most people like to call it the gender reveal test, because you do get to find out the gender, but what it's really there for is to screen for Down syndrome, which is trisomy 21, trisomy 18, and trisomy 13. Unfortunately, those are the only 3 that it screens for, so that does not kind of take away everything else. And then you get the nuchal translucency ultrasound, which is between 11 and 13 weeks, to see if there's any obvious anatomical structural abnormalities, which would then reflex to maybe going to high-risk doctors to get a sample. So I don't know if you've heard of an amniocentesis, where they go in and actually extract fetal genetic material to test and see if there's something outside of those routine screening.
Yeah. Which used to be the only way they could even do like the Down syndrome test, all of that, and so it's cool now that they have the blood test for, even though it's not for everything, that it's, I think, because I've had people ask me, hey, should I get this done? And it's a very different discussion than it was 30 years ago or 20 years ago.
Because it's not without risk.
Yeah, because back then, the only way you could get those tests was actually doing that amniocentesis, which was, a higher risk procedure. And it's like, well, now tell that it's just a blood test, that's a very different scenario, so.
And some people elect not to have the genetic screening. But then if you get to your anatomy ultrasound and there are some concerning features that we're seeing, we'll say, hey, there's something called soft markers that are concerning to us, that maybe these are phenotypically more consistent with a genetic disorder, then we can go back and get that genetic screening done. Yeah. But the amniocentesis does have a time cap to it.
Right. Yeah. I know. It was really cool also, like being able to find out, the gender so early. It's like
it is
wild that you can do that, like even, before the anatomy scan.
It is. But I do like to always be like, but it's also for genetic screening. But it is fun to get to find out and like open your envelope and see all that.
Yeah. Mm-hmm. So I guess something else probably that's important are like warning signs. Because I feel like, especially in pregnancy, it's very easy to be like, oh my gosh, this is different. And it's like something to worry about, or it's like, no, you actually don't have to like worry about that. So like what symptoms would you say, hey, if this is going on, you should be giving us a call like ASAP. Like should not be ignored.
So just vaginal bleeding. Yeah. Any vaginal bleeding in pregnancy is not normal.
Yeah.
So that is something that if you're, it really just depends on kind of where you are in terms of gestational age. If you're having a little bit of bleeding, a little bit of spotting, and you're in your first trimester, I would not fully panic. You can just call your OBGYN and kind of go in when they have something available. If you're having significant bleeding, then you could just go to the ER at that point. Once you're viable, which is 24, some will say 22 to 24, depending on the hospital that you're at. Those are things that you should promptly go to the hospital. So any kind of vaginal bleeding, not normal. Severe abdominal pain, abdomen is hard, very concerning. That's something you should go straight to the hospital. In terms of, fetal kick counts, there's your OB will tell you certain things that you do if you don't feel your baby move, like ice water, chocolate, something a little caffeinated, go in a quiet room. If you really still can't feel your baby move, then absolutely, we're never upset that you came in because you couldn't feel your baby move. We'd rather reassure you and make sure that everything is okay, because it could be a sign of low fluid. It could be a sign of something's going on with the baby. So
sometimes the baby has to be delivered right away, right? So
exactly.
That's the whole reason why they say to do the kick count.
Yeah, exactly. So it's never like, oh, you're, of course there's different anxiety levels, but, we always would rather you err on the safe side in terms of checking on your baby to make sure everything is okay. And then in terms of not directly uterus pregnancy related, but, any neurological changes, I suddenly have a severe headache. Facial droop, because seizures and strokes and things like that are also, I wouldn't say common, but can happen in pregnancy, especially with preeclampsia. So any kind of seizure-like, symptoms or neurological symptoms, headaches, chest pain, shortness of breath, difficulty breathing, feeling like you're drowning, you can definitely have heart failure in pregnancy. And those are all signs of preeclampsia, and they can happen very quickly.
And then this is a question because it happened to me. I become a klutz in pregnancy. I fell.
You sure did.
Yep, I did. If somebody does happen to have a trip and fall during pregnancy, first trimester, different than third trimester. So what would you say, depending on where they're at in their pregnancy, that somebody needs to do if they tripped and fell?
So if you trip and fall and you land directly on your abdomen, I would potentially call an ambulance and go straight to the hospital, because you need to be checked out immediately. If you trip and fall and you land on your butt or you catch yourself, I would still go get evaluated, because even though you did not have a direct fall, that sheer that sheer
movement,
that shearing
shift,
Yeah, or if you get in a car accident and you kind of get that jolt, that can still potentially cause a placental abruption, which is what we worry about, where the placenta kind of separates. So you should absolutely still go in or still call your OBGYN, because you do need to be monitored for a certain amount of time. So tripping, falling, anything that would have caused a sudden movement, you do need to go get evaluated. If you directly fall on your abdomen, that's obviously more concerning and you need to very, very quickly go in.
Yeah.
Or if you're in any kind of trauma, whether it's unfortunately domestic abuse or a car accident or someone shakes, anything like that, you need to be evaluated.
Yeah. I know. Or you have like a crazy toddler. There's,
Yeah, or they kick you.
So many things.
Yeah. But all that to say, I've had patients where, my dog stepped on my belly or, my toddler, the baby is protected. There is amniotic fluid. So again, you should not be staying up all night freaking out, being like, my doctor said, don't call about this. But, if it is a significant trauma to your abdomen, absolutely. But if, the dog did something or if your toddler pushed on you a little bit, typically not something to be overly concerned about.
Yeah. Yeah. That makes sense. I think you mentioned some of the signs for preeclampsia. What about like gestational diabetes? I feel like typically that's caught like in screenings, but not always. Like what
Not
should
always.
people kind of, look out for?
So it's hard for people to specifically look for those symptoms themselves because you're already peeing a lot in pregnancy. So typically if someone's not if you're not pregnant and then you're suddenly very thirsty and you're peeing a lot, those are the things that we tell someone to look out for. But unfortunately, those things are happening already in pregnancy. So you're not really picking up on that. A lot of times, especially that I'm a hospitalist now, and we do see a lot of patients with no prenatal care, is they come in and they give a urine sample and they've got a crazy amount of sugar in their urine. And that typically is our first kind of telltale sign. Other things with ultrasound, which again, you would not be able to tell, is polyhydramnios, which is an excessive amount of amniotic fluid around the baby, or a baby who's measuring really big, kind of above that 95th percentile. These are typically side effects of untreated diabetes.
Yeah.
But for someone, most people don't know that they're diabetic until either they come in and deliver, especially where I work now is you're like, oh, that's a big baby. And we don't like being surprised with big babies.
Yeah.
But typically it's hard to tell on yourself.
Yeah. I think the other questions that people always ask me, can I have sex during pregnancy? Is that safe? Like,
sometimes.
Is it safe? And then when should it be avoided? Which you kind of talked about before with like, depending on where the, with the placenta and everything, but.
Yeah, so it is safe. But again, it is up to your comfort level. If your partner is going to be freaking out that, whatever they think is going on, like they're not hitting the baby's head, they are protected. So it is something that's good for you and your partner to talk about and see, because you should not feel like, hey, my partner doesn't want to have sex with me and I want it. And then there's this kind of tension regarding it. So exactly. So it's something, and it's great for partners to also come in during the OB. Like it's very important for the partners to come in and listen. And, they might have questions like themselves in terms of what should I be doing to support her? It is absolutely safe to have sex in pregnancy at all times throughout every trimester. Things may feel different and that's okay. And you may be doing different positions for comfort level, especially kind of later on. Like I mentioned, there are certain contraindications, such as, if you're prematurely dilated, if your water is broken, if you have an abnormal placenta, certain things. So definitely, if you ever get diagnosed with something in a pregnancy, always ask. Your provider should be telling you, but not always. So if there's any concern, always ask, and they'll be able to tell you if it's okay or not.
Yeah. And what about travel? Because I think that's also something, you did. I did. Probably a little bit too late. But
that's okay.
So is it safe to travel in pregnancy, And I guess also like ideal times, what should people be considering when they're making travel plans,
Yeah. So it's safe. The problem is that we do say it's probably not a good idea to travel after 36 weeks. And it's not because it's not safe to get on an airplane, but you do have a higher risk of going into labor. So you probably don't want to have a baby on an airplane. You don't want to be somewhere international having a baby and, you don't have your doctors or your provider, or you're in a different city or town without your family. So it's not that it's not necessarily safe. But after 36 weeks, we do highly recommend that. And I don't believe most airlines, I don't know the answer to this. I know that people will say airlines will require documentation, but I don't know what point do they ask?
Yeah,
to
I'm
be
not
honest
sure
with you.
either. Yeah. But I mean, I could see them asking, because I'm sure they're like, we also don't want you delivering on our
Yeah, so I don't know if they see you and then they're like, you.
Wait a minute, I'm concerned.
Yeah, I've always meant to look into that, but I really don't know how they do that. But I think I've heard most airlines won't let you travel past 36 weeks, but I don't know how they go about that process. But the other thing with traveling long distances is that hypercoagulable state that we were talking about. So even if you're traveling in a car or an airplane at any part of your pregnancy, I do recommend to get up and walk every but 1 to 2 hours, whether it's in a car, stop, do some laps, wear compression socks, maybe even take a baby aspirin. Again, ask your doctor if that's okay. But those are my recommendations. If you are traveling, the second trimester is your sweet spot because you're finally feeling better. You're finally not nauseous and having all these food aversions. You're like, wow, I'm pregnant. You're kind of sleeping again. And so second trimester is your good sweet spot for travel, but with still these compression socks, get up and walk, do all those things. Third trimester, you really want to kind of stop around 36 weeks. And then again, it depends on your pregnancy and your risk factors. Some people were like, absolutely do not leave anywhere. You got to stay within a radius. Because some patients we actually discharge from the hospital, but we're like, how far from the hospital are you? So some people really need to be in a very close vicinity to the hospital. So always check with your doctor.
Yeah.
But
well, and I also like, it's the common sense part of it too. Like, you don't want to deliver on an airplane,
You don't,
like you kind of want somebody delivering who knows you, who knows your pregnancy, even in like an uncomplicated pregnancy, right? So there's always like, as you get further along, it's like, the closer you are to your due date, well, the closer you should stay. But
there's going to be 2 people that are 36 weeks at my wedding. But I did say, we will have 20 OBGYNs there.
I was gonna say, I feel like they're more than covered. So a little bit different.
But typically I say no traveling, but they should be covered there.
I feel like that would be safe. It's like a little different than like I wanted to go like camping on like Cumberland Island, which is an island that you can only get to by boat. And that's
a no.
That's an appropriate view.
Like that would be like absolutely not. Yeah, for sure. Yeah, but again, every pregnancy is different. Even with your own pregnancies, like you said, the 2 were completely different. So always check with your doctor because it might be something that you don't know.
Yeah. And then I think people are more aware of this, but like everyday like cleaning products, household products, things like that. Are there things that people should be cautious about, like handling, and kind of having around?
So the main big one is, cat litter. I think that's one that I think most people know. That one is that the risk of toxoplasmosis. So, if you have a cat and you're pregnant or trying to get pregnant, you really should not be handling cat litter.
Yeah.
I would say that's the main one in terms of household, of course, with all the chemicals. I know not everybody's doing this, but some people are switching to kind of more natural products overall. I think there's a big shift in society now to doing that. But just like with everything else, you don't want to be inhaling, like in a closed, not circulated, you don't want to be cleaning with corrosive chemicals in the garage closed. Nobody really should be doing that. But I would say there's no chemical that I can think, like in terms of home cleaning products, that I would say absolutely do not use that, other than cleaning cat litter. But overall, just use caution in terms of don't inhale it's not good for anyone.
Yeah. And honestly, if it's like how I was, and for both of my pregnancies, I felt like I was so sensitive to all that stuff. Almost any smell that was like strong would be a major trigger for me. So I feel like there's
hopefully your partner's doing all the cleaning anyway.
Yeah, exactly. Yeah. So I feel like there's a lot of like with those changes, sometimes it's probably like protective, right? Because it is. You can't handle it.
Actually, it is interesting. I don't remember what I was reading about like smells and things, and they're saying it's likely a physiological thing because your aversions to meats and fish and eggs is back in the day, these were the things most likely to have bacteria overgrowth. So it is the body's physiological mechanism of having aversions to things that might be bad for you.
Yeah.
But nowadays, obviously meats are handled differently.
Yeah. Yeah. No. And now we can you can actually check the temperature, and you can cook it right away. You're not like, you had a cow.
You didn't kill it. Yeah.
You don't know how long it's been out for and all that stuff. So it's a little bit different. Modern advances, it's amazing.
Look at that. Yeah. Well, the body still tries.
Yeah. But, all right. Anything else that you can think of that you would want patients to know? I think we hit all the big things. Those are all the ones that I feel like I had questions, or all my friends have questions and have, always ask.
Yeah. I think the biggest thing is, I think there's a huge shift with social media and information overload. And I think it's most providers, or at least most of the providers I know, we don't, it is okay. You should absolutely go ask the questions, understand why we're doing certain things, and understand why certain products or not products, medications are offered, or certain things, because there's a reason behind it, and informed consent is very important. You shouldn't ever feel like your provider is forcing something on you without explaining to you the reasoning behind it. So, taking all the internet information with a grain of salt, but asking the right questions and being able to get that, and then you can make your informed decision based on that, is the new thing that we're all having to navigate.
Yes. Yeah. But it's important. But I also think it's, that's why things like this are helpful, because, it goes over so much. And I feel like so many questions that, I know I had when I was pregnant. So
yeah. And ask your provider. And every pregnancy, don't compare to the internet and this mom who was this way at this gestational age, or, every pregnancy is so different. Even every patient that walks in the door, we tailor our care to them. Nobody is the same either between your own two pregnancies. So don't compare.
Yeah.
That's the big thing.
Well, thank you so much. This was awesome.
You're welcome. You're welcome. I hope this was informative.
It was very informative. And I am sure that all of our listeners, enjoyed everything and learned a lot. And as always, this is not intended as medical advice. This is for educational purposes only. And
of course,
thank you so much for joining us, Dr. Megally. This was awesome. And hopefully we'll have you back soon.
Okay. Well, thank you for having me on. This was so fun.
Thank you for joining us for the Duration Wellness Show. We hope you feel equipped to apply today's science-backed insights to your daily life. To find show notes, past episodes, and all the resources we mentioned, visit us at durationwellness.com. As always, this podcast is for informational and educational purposes only and does not constitute medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The views and opinions expressed by guests are their own and do not necessarily reflect those of the host. We'll see you next time, and as always, we're here with you for the duration.